All right, we're going to have Introduction to Electronic Health Records, Chapter 1. All right, so what we're going to do, our learning objectives are going to be on exploring the history and current use of patient health records, their importance to individuals, health, and the contributions to the healthcare system, become familiar with the content of a typical electronic health record, also known as EHR, explain who documents in the health record, discuss ownership of the health record, and describe the basic functions and advanced clinical decisions supports the features of the EHR software. So we're also going to define practice management software and explain how it is used with the EHR system, describe advantages of EHR system, describe the disadvantages of EHR system, identify the roles of various healthcare professionals in implementing an EHR system, and investigate various professional organizations aimed at promoting the use of EHR systems. All right, so a patient's health record. So many of you who have gone in may notice that the medical assistant has a tablet, a laptop, or there's already a computer that they use that might be on the wall that hangs down in some of the medical offices. Everybody has a different system that they use. And so I put in a picture of what you all may start to see as a medical assistant. So let's take a look at this. And I'm going to circle this with purple. So this right here, what we're looking at, is just kind of an example of what you may see. You're going to have your, let's look at, you're going to have your pharmacy right here. What is the pharmacy name? They usually don't do cross streets. What is the pharmacy phone number? Let me go ahead and erase that so it can look better. I'll just highlight it. So we'll highlight this. So we may have the, oh, never mind. Let me erase that again. I'm so sorry, everyone. I was trying to find the highlighter pen. Maybe that's the highlighter pen right there. Let me look. All right. No. All right. So I'm having fun with this. This is really fun. All right. Let me just go ahead and erase this. And I'm going to erase this line. All right. So we go back down to it. So if we look at this, you guys may end up getting something that looks similar to this. Do they have an advanced directive? You all will learn about that. Do they have a living will? Do not resuscitate, oppose? What kind of medications are they on? What's their dosage? So let's say they're on a Atenolol and they're at 2 milligrams and once a day. What is, the directions? What is their conditions? What is the treatment you might have? And I don't have this pictures and blown up, but literally you'll have different things on there. So a physical collection of an individual's healthcare information is really what's on that health record and just used throughout the history to document. So you're going to document the patient's health care, the signs and symptoms of diseases, and the trends of the diseases. All right. So each patient has his or her own record, and the documentation is a vital component of the EHR. So it contains the health information, administrative information, and legal documents. Your legal documents are things like the do not resuscitate, um, things that are like your living will. Administrative information is going to be your um, insurance information, then you have your health information that's in there. All right, this is all pertaining to you. So if you're married, your husband's going to have his own record, your children are going to have their own record. They don't have anything that's ever like a family record. All right, clinical information. So you guys are going to have a medication list. And at this point now, what they're doing, medication lists, they're really cool. I've worked on some electronic health records that when we would put in the actual medication that the patient was on, it might list their diagnosis. So some of the things have really advanced quite a bit in the hospitals. You'll have an allergy list. Allergy lists are usually, let's do this. They're usually in this little red. Oh, I should pick red. All right, they're usually like right here, and you'll have like up here that's alerted. And I'm just going to put an A in here for allergies. All right. So typically you guys will have that. They'll have like a little box listed at the top that'll show you these are all the allergies because those are super important. Um, Nobody wants to be given something that might cause an adverse reaction. Immunization records, pretty, when you're working with peds, like the pediatric patients, and theirs is going to be huge because they come in all the time for immunizations. And as you advance as an adult, a lot of times they find out, have you had a Tdap? That's tetanus, diphtheria, and pertussis. When's the last time you had one of those? Those come every 10 years. Some cities might make you have an MMR if there's an outbreak of measles, mumps, and rubella, those type of things. And of course, we have the new one, which is COVID, right? Your laboratory reports are going to have things that are like x-rays, your ultrasounds, CTs, anything, and of course your blood work. All of those things are laboratory reports. Pathology reports, you're going to see things like, let's say you had a surgery and they took a piece of tissue from that surgery and they sent it to the pathologist. Those are type of things. They don't have listed in here cytology. Cytology is what they use for pap smears, those type of things. But you're also going to have your vital signs area, and that's usually with every visit. And so growth charts are really only in pediatric charts. They're not in adult charts. Now, I will tell you, let's say that you're new to being a medical assistant and you're trying to get used to using a blood pressure cuff and they don't have an automated one. If you go in that patient's chart and see what they average, then you can kind of train your ear to listen. If they, let's say they run 140 over 90, so you're not going to automatically assume that, but you can really train your ear to be like, hey, I'm sure I'm going to hear that first thump at around 140 and the last thump around 90, if that's what they trend. So that's just a little extra little piece of information for you. All right. Administrative information. So there's patient demographics. That's where you live. That's your address. Those are the type of things that's in there. Then you have the name of your emergency contact person. They always want to have somebody listen. You're not married, have your oldest child. If you don't have an oldest child and you're not married, your best friend. Those are things that you want to make sure that you're doing. The patient correspondence, how do we get in touch with them? Referral and consultation letters. So your patient correspondence is anything that you might have sent. And, back in the day when we had paper charts and people would send Christmas cards, graduation invitations, it would be all the way in the back of the chart. And now, I'm sure if they do it, they may scan it in, but typically, the patient correspondence really, I could see more or less worked really good with the paper charts and not so much of an electronic chart. Okay. Referral and consultation letters. So if you normally see Dr. A, but Dr. B and Dr. C has sent referrals and consultation letters, then that's going to be in that section. And your insurance information should be in the front, but you guys are going to have tabs. Okay. So, just like, let's see here. Let me use this color. Let me use this color. So just like, let's say you have on a computer, you have a tab here, you got a tab there, 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 and then you might have tabs over here, tabs over there, tabs over there, tabs over there. It's kind of like, think about your canvas. You can click on stuff in this area right here, but you can also go over here. You could click on this area. So these are just tabs that they have. So this one might be your insurance tab. This one might be your medication. This might be your demographics and stuff over here. It just depends on how your EHR is set up for whoever you're working for, okay? All right, let's get rid of that because I want to go and move forward. All right, so legal documents. Your legal documents are your records release. Who can see that? You could be married and don't want your husband to see your medical records, or you want to really make sure that whoever you're able to release it to, that's who they have the paperwork made for. So you give it to another doctor's office, you still have to do a records release, unless it's usually if it's within the EHR, EMR system, they can just go right in and grab the information themselves. Informed consent documents, that's like if you are having, let's say you're getting an IUD, you're getting HPV, these are, or any vaccinations, they need you to sign an informed consent document. Your HIPAA forms, those are super important. So these things they give you pretty much up in the front when you check in, or you have an electronic version. Advanced directives is something that you need to go over with your doctor. Um, if you're single, you just make an appointment with the doctor and you guys will go over what your advanced directives are that you want to do and your living wills while you're alive, those type of things. And then also the healthcare power of attorney form. If you're married, these three things are typically what you'll go over. And then you have your insurance authorization forms. Okay. And then an individual who's responsible for inputting information into the medical record, that would be you. All right. So it's going to be the person who is like the documenter is either the front office or back office. So you have your receptionist. Well, most people call them um, patient care reps now, and instead of like a receptionist. That's kind of a really an old-fashioned term. Then you have your medical assistant. You have your physician are really like your healthcare practitioners, because you can have a nurse practitioner, you can have a physician's assistant, RN. These are people who can also put stuff in. Your medical billers, some of them pretty much work in the office now. Some work away from it, depending on how big the practice is. Or, so let's say that you work for a big hospital that has like clinics that are attached to it. They will probably have a medical billing area. They may not be in the actual clinic themselves. Then I already said your nurse practitioners. And then structured data entry and free text documentation. So what does that mean? So structured means it's already there. It's just like your tabs were on the side and you click on it and it says medical record. You can't like change that. What can you do with that? You can add your free text documentation. So let's say there, and to be honest, it depends on the system, because most systems now you could put in the first three letters of the medication, and whatever medications that have those first three letters is going to pop up until you find it. But there's been times when I had to send out what we call normal letters. Let's say they had normal labs, they had a normal pap smear, or they had a normal visit. Then we would have templates, so we would hit letter to patient, and then it would just populate good morning, or hello, Jane Doe, or just sending you information to let you know your labs were normal and blah, blah, blah. In today's world, most of this stuff is coming by email or text, and you click on it, and bam, in your patient portal, you'll have all that information. So, free text documentation, I think more or less in today's world, you do some of it, but like if you called a patient and the EHR system that you're using doesn't allow it to just automatically input it. Like when I was using EHR, if we did a letter, it automatically saved the letter. So we didn't have to document that we sent the patient a letter. But if we talk to them on the phone, we did have to go in and free text, talk to patient. Patient is aware that their labs were normal, blah, 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 that type of deal. All right. All right. Now, here's where it gets tricky. So, who owns the chart? Who owns the health record? So, let's just take this back to a paper chart to give you just a little bit of how you could really envision this. The actual paper chart, the doctor owned it, okay? They owned the physical record, but the information that was put in there is what the patient is the owner of. So if I, as a medical assistant, document Jane Doe came in not feeling well, blah, 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 had right arm was swollen, looked like it could have been a sprain, that's what Jane Doe owns, but the doctor owns the actual physical record. So now let's switch that into what's an electronic health record. So of course you don't actually own the computer, the laptop that's being used. You own the information that's being input into your medical record. Okay? But the doctor owns that software. The doctor owns everything else. But that information is yours. Okay? So the patient owns the medical information and they may obtain a copy by signing a records release. They may be charged an administrative fee. Let me tell you guys something that's quick and easy for just for your own personal use. When you go to the doctors, and if you have a doctor that dictates really fast and they have the actual information in the computer, ask for a copy of your visit for that day. And either that or go to your patient portal and print it. And therefore, you can already have that. If you have to get usually like over 25 pages or so, they may start charging you like 10 cents a page or something on that level. Okay. All right, patient medical record in electronic format, and there's 8 core functions of the EHR system. All right, let's see. Uh-oh. All right, so your health information and data management. You have results management, order management, decision support, electronic communication and connectivity, patient support, administrative processes, reporting, and population health. These are what the functions are of that electronic health record. And so there's people who this belongs to that we don't have to deal with. So the decision support, order management, that is all on a management level. So we don't deal with that as medical assistants, but these are the functions of the EHR. All right. So some of you might know who Bush is. He was a former president, and he declared 2004 to 2014 the decade of HIT, Health Information Technology. So the Office of National Coordinator for Health Information on Technology says promotes the universal meaningful use of electronic health records. All right. So the Obama administration continued to endorse and promote universal use of certified EHR and CPOE. Okay. So this was the transitioning from paper to electronic records. I came in the medical field in 2000. So in 2004, we didn't see it, but 2008, that's when we had to go, we went through all this training where the paper charts were going away. It was tough for some people, especially some of the older doctors, that they just could not fathom how in the heck were they going to use a computer to do any of their documentation when they're used to writing. Which I'm glad, because I used to always say if you could understand your doctor's writing, that was great. But typically you can't really understand the doctor's writing. Okay. All right, as of 2017, implementation rate of 86.9% for physicians' offices with 78% using a certified electronic health record, which means I'm sure there's tons of different types of software. I've worked with some in little itty bitty cities where they had some stuff that was kind of hard to use because it wasn't as streamlined. So it may not have been certified EHR. There's penalties for these companies that don't use it. So like if you do, like if you're out in an outlying area where you have um, a doctor's office that is private or what have you, they may not be using it, which means they're getting taxed quite a bit. The meaningful use incentive program, so it's to improve quality, safety, and efficiency. Imagine when a doctor used to write out a prescription and you can't read the writing and they give you the wrong medication. So that and the fact that maybe they're writing, you can't read. Imagine if you had 35 to 40 patients a day and you wrote. Do you think you're going to write really good? Absolutely not. Or if they wrote for someone else to transcribe it, you know, I had a doctor that wrote with a font so tiny. Let me see if you guys see my hands. It was that big. And I never forgot it. I was like, you almost need to magnify. It was neat, but it was so tiny. Imagine when you see number 8 font, how tiny it is, and it was half of that. Okay. So it's also to engage patients and family, improve care and coordination, which is, from going from one doctor to the next, and also to maintain privacy. Um, with electronic health records, we can go in now and see who was the last person looking at your chart. So I will caution you, if you have family members who have um, charts, you cannot go into them. They will figure it out and you will get fired because that is a violation of HIPAA. You absolutely cannot. I cannot even, if I go back in the medical field actively and work in a clinic where my husband's records are there, I cannot go into his records because it is against the law. And I don't want to get fired, right? And we have known people to do that. They've gotten fired for going into charts they don't have no business going into. All right. EHR versus EMR. This is where people really don't like electronic health record versus electronic medical record. So let's say you work for a big clinic called Swedish. I'm from West Coast. We have a big hospital conglomerate out there called Swedish, right? They have clinics everywhere, all over the city. They have clinics all through the hospital. That is EHR. That means that that doctor who is across the way, let's say they're 5 miles down the road at a different clinic or working in a hospital, and they need to get Jane Doe's records, that's EHR. They're not directly in that clinic or in that patient's room. EMR, electronic medical record, if I'm working at the clinic, that's really just for us in the clinic. However, EHR still has access to it. I hope that helped you understand the difference. Remember, you're working at the pediatric clinic, it's EMR. You're working at the hospital and you need something from that pediatric clinic, that's EHR. Does that make sense? Ask me later if you don't get it. Okay? Basic EHR functions. Do you realize that you can fax and message from there? Really, now the doctors are the ones that are faxing the prescriptions, which is a wonderful thing. If you all were medical assistants back in the day, we used to have a stack of papers. I'm trying to make my hands right, about that high, and we had to go through them and we had to check them, and we had to go back and check their charts and see if they were up to date on their annuals, and then we could either go ahead and fax it back or call the prescription in. Now it just goes straight to the pharmacy, which is wonderful. You have patient reminders in there, the vital signs data, which is so wonderful because you can have vital signs per visit, but if you have vital signs that you can click on and see what is it trending, has their temperature been running the same? Is their blood pressure running the same? Those are things that we need to know. Okay, temperature, blood pressure. And some places you may do respirations if you work in a clinic that deals with your lungs, all right? And then importation of data so that we can send it to other places. Automatic flagging. You'll say, hey, wait a minute, there's a red flag on this. Do they owe money? Is there something wrong with their prescription? You can email them from there. You can print, and then there's progress notes. And your progress notes have everything on there of what that visit was. So if you went to go see the doctor for follow-up medications, that's what that progress note's going to be. If you went to go see the doctor for an annual, that's what that progress note is going to be. Okay? And they have different templates for those. One might be more in depth than the other. Okay? So you do, I just said that you have documentation templates, you have the provider review of incoming data. Oh, you have image attachment. So if you have, let's say you got an EKG or you had an X-ray, those things, they're going to have a tab up here at the top, remember, and it might say labs. And when you click on it, then that EKG has been scanned in, that image of your X-ray has been scanned in. You have an area for electronic signatures. You have the prescription templates, which is typically only available for the doctors or the RNs. We just don't have that capability, which is fine with me because that takes one thing off of our plate. All right, clinical decision support. This allows providers to set protocols for specific patients and or conditions. So this is based on evidence treatment protocols. So you have automated preventative care reminders. So if you have an annual, you're going to start getting um, reminders about maybe 1 to 2 months ahead, so you can maybe, let me back that up, about 3 months ahead, because your annuals are pretty tough to make those appointments. They want you to know, hey, you have one coming up in June and this is April, and they're letting you know. You have your treatment plan templates, you have your data reports, you have your documentation templates, which are wonderful because if your templates are set up, then all you have to do is click on it and maybe add and tweak a couple things. Okay. All right, administrative software is used for patient demographics, billing and insurance, appointment scheduling, and advanced accounting procedures. So these tasks are now incorporated as part of the EHR. I just want to give you a little heads up. So appointment scheduling is not just for front office. You still will have to learn how to do it, because if you're sitting at your desk and Dr. X comes out and says, hey, Jane, I need you to do a follow-up appointment for this patient, but also make sure that they're getting um, a CT scan that day as well as labs, and make sure they're coordinating. So sometimes you're going to have to be the one to do it because the doctor asked you to do it. And don't tell the doctor, well, they can do that on the way out at the front. Is you work for the doctor, you are the medical assistant to the doctor. And if you are front office, then yes, you're going to be doing the patient demographics. You're going to be making sure that they have the correct billing, insurance information. You're going to do the scheduling, and the advanced accounting procedures are for billing. So if you're a biller and coder, that would be for you. All right, so advantages of EHR. So this is improved quality and continuity of care. So it's managing patients with chronic conditions, or even if you don't have, usually if you're in the younger generation, let's say you're going to internal medicine, you might just be going once a year for your annuals. You may not have chronic conditions. Also, that disaster preparedness and response is able to be an advantage of EHR. So think about a disaster. It wasn't so much a disaster, but we had a big, huge deal with COVID. And thank goodness that we already had EHR in our systems, because we knew about how to use it. So that way you could track it and you could see, how many people lived when it first came out, how many people died, that type of deal. How were we able to respond with that? Increased efficiency. Let me tell you how wonderful it is. If you've ever worked with paper charts, charts get lost, or doctors like to take them home because why? They were using paper, so they had to write and then put that in the chart. With EHR, EMR, the doctors are able to access this from home. You know, the charts are there, they're in the system. We love it. Improved documentation. One of the things that I noticed, like when I first start working with EHR and EMR, we really had to know how to spell. And that was something that I was good at. But I remember one um, MA, she said patient fell off bike because she didn't know how to spell fell. Now, a lot of times you put it in and it's generates the correct spelling. But I will say, I'm not sure what's going to happen with AI because AI might make it where if you look at some of our social media now, the AI is already incorporated in it and it kind of can guess what you're trying to say and you just hit enter. Easier accessibility at point of care. Absolutely. We're not looking all over the place. You have your labs in there. You have your well, all your labs also are like your imaging. You have all of the your charts, like all of the patient records. You have your medications. You have everything in there. All the letters. Everything is in the actual EMR, EHR. Better security. Again, they know everybody who goes in and logs in before the paper chart. People could just go pull a chart and go look. Oh, let me go get my boyfriend's chart and pull it. Or let me go get, my wife's chart or, my children's chart. And you're really not, even if you are the guardian and the parent of a child, you still have to get permission. You just can't just go in it. It reduced expenses so much easier than having to send stuff out in the mail. Improved job satisfaction for providers and staff. Once people really got used to it, like we started out in 2008 up in Seattle, Washington, and by the time 2011 came, it was super easy and also had improved patient satisfaction. Okay. All right, the disadvantages of the EHR is the lack of interoperability among some products, initial costs, financial investment, implementation time, employee resistant, regimentation, and security gaps. That was then. Now it's so much easier, and there's been so many improvements to the software, so many more improvements that it should be fine. All right, role of the healthcare professional. So there's basic skills that are needed. You have to have knowledge of medical terminology and anatomy and physiology. Every part of the healthcare is important, and there is no exception. So basic typing and computer skills, yes, you have to get comfortable. It takes time, but you can get it. And I'll tell you all, I never took a formal typing class, and they offered it back in the day when I was in school. But because I've been on the laptop and computers for, let's see, I started in 2001, so it's been 23 years. It's natural now. And I got it pretty much in about 3 to 4 years, I was really proficient. Organizational skills, preparing yourself um, to go paperless, and then also interpersonal skills. This helps the patients get through the transition as well. All right. All right. Administrative duties. Performing reception, front office duties. So those are scheduling appointments. We just talked about that. Creating electronic charts. So this is the deal. So with a patient calling in, so let's say you are a front office person, and Jane Doe calls in and say, "Hi, are you guys accepting new patients? I'd like to get with Dr. X." Yes, we are. So can I get some more information from you? They're going to get the date of birth. They're going to get other things. Mainly what they're going to get is that insurance because they need to run the insurance and make sure that that doctor has already been proxied to uh, to be with that insurance. And most doctors nowadays take a wide variety of insurance because what this does is makes it so they can get whatever patients they can get. Um, So you create just a basic electronic chart. You also want to make sure that that patient hasn't called before and has a chart hanging out. So you want to make sure that there's no duplicates. You want to purge inactive charts, any charts that have been there for 3 years that nobody has been back, came in one time, never came back. um, Gathering and entering patient data, creating patient correspondence, maintaining email communication, providing patient instructions, and coordinating care. So those are some of the roles that the administrative office, front office will do. Clinical duties. You will document treatment, coordinate patient care, documenting the following: patient history and physical, vital signs, progress notes, details of the patient's visit, laboratory requisitions, um, prescriptions, test results. Those are some of the clinical duties. All right, billing and coding duties. So you create billing statements, assign procedural and diagnostic codes. That comes from the doctor. Linking the codes for reimbursement, auditing them, filing patient statements, submitting super bills and then counter forms, organizing office finance, generating prior authorization forms, and monitoring submission and follow-up claims. Professional organizations. So the benefits, they offer certification exams at a discounted rate. So this is your lifelong learning. A wide range of continuing education units, networking, newsletters, and professional journals, discounts on publications, sponsors, conferences, workshops, and web-based activities. I belong to the AAMA, which is for Certified Medical Assistants. So I can keep my CEUs up. Every 5 years, I have to have 60 CEUs. And I can go to a conference and knock out 20 of those CEUs in one conference. It's a little costly, but the conferences are great. All right, American Health Information Management, AHIMA, is typically for your front office. The AAPC is for the professional coders. AAMA and the NHA are for the medical assistants, and AMT is American Medical Technologists, which is also can be used for either people who are in the healthcare but may not be a medical assistant, but you can still do it as a medical assistant. Does anybody have any questions? If you do, please make sure to email me. I hope this has been helpful, and thank you.